The world is hurting right now, and it's time to rise up. As we lift ourselves up in body, mind, and spirit, we can reach out to others and be a light in a sea of darkness. Welcome to the Movement for Global Health with your host, Dr. Mary Zennett.
Brendah Kihara is a registered and licensed nutritionist. She is passionate, reliable, and hardworking, and she possesses the depth of knowledge and experience that has a tremendously positive impact on the patients and clients under her care. She's currently working in academics as a nutrition and a dietetics educator. She excels in multiple areas, and I might add, it's very impressive. Maternal, infant, and young child nutrition, integrative management of acute malnutrition, critical care oncology nutrition, critical care nutrition, infant and young child feeding emergency, acute malnutrition in emergency preparedness response. And outside nutrition, Kihara enjoys participating in charity work, hiking, roller skating, and zip lining. She's also a member of the President's Award in Kenya, an award which is a member of the Duke of Edinburgh's International Award Association. Kihara, Brendah, it is an absolute privilege to welcome you to our podcast and to our guests.
Thank you for having me. I'm really happy to be doing this.
This is wonderful. And we are broadcasting directly. You're in Kenya, correct?
Yes, I'm in Kenya right now.
What part of Kenya are you in?
Well, I'm in the central part of Kenya called Kerugoya. So that's where I am right now.
Okay. Wow. So, and your experience is amazing. You just real quick, where did you get your training?
I just got my training just here in the country in a university called Mount Kenya University.
Okay.
I pursued a bachelor's degree in nutrition and dietetics.
Okay.
Yeah.
And now you're working in academics as a nutrition and dietetics educator.
Mm-hmm.
Yeah. Please tell us what you do. Like, what does a typical day look like for you?
Well, so I wear many hats. Actually, I'm not just an educator. I am also a clinical nutritionist at two facilities. One is a cancer center, and the second one is a medical and cancer center. So I actually wear three hats. So typical day is quite busy for me. My day starts quite early, between 4 a.m. and 4:30 a.m. I go to work, I go to the college, read a book, study something, read something. I try to ensure that the very first early hours of the day, they are productive on a personal level.
Mm-hmm.
So around 8, that's when my official duties start. So depending on the days, I'll either be the whole day I'll be at school teaching or taking assessments, or I'll be at the hospital, either of the hospitals or both of them. So I finish up with one of the hospitals and then I go to the other hospital. So what I do in those hospitals is I majorly work with cancer patients, assessing them, providing medical nutrition therapy for them, referring them where we're not able to help. Basically, that's what I do in the hospital, and also health education. At school, I take my students through the course outline for nutrition, for community health. I also have students who are doing social work. So that is basically what I do in a day. And my day comes to an end. In terms of work, my day is over at around 6 p.m. and then I can now start my plans on going back home, preparing for the next day, and things like those. If I have a webinar, I put it, I schedule it for the evening hours when I am a bit flexible.
Wow. So you've got a really robust day.
Yes, I do.
And you know what? I want to say this. You're such a role model. You get up early, your personal practices, and you're studying, you're grounding yourself, you're getting yourself prepared for the day, because patient work is very intense. It's very draining. And you've got to recharge when you're doing that level of work. And there's always new advances. There's always new things coming out. And you are truly, you're an exemplary role model. So I hope our listeners can hear that. Because it really, and it really shows. It really reflects on all that you do and the number of people that you help.
Thank you. That's really encouraging. Thank you so much.
Oh, it's a privilege. It's really a privilege. Tell us a little bit about nutrition and cancer. We hear some of it, we hear about it, but like in your case, are these patients hospitalized? Are they in a hospital?
So the facility I work with, one of the facility is only an outpatient facility, which means that the patients are not admitted. So they come and then go back home. If they need to be admitted, because there are those cases that are quite critical and you just can't let the patient go home, we have wards nearby where they can go and get admitted. It's still part of the hospital, yes.
Okay.
And then the other hospital I work with, it's both outpatient and inpatient. So there are those I will see in the outpatient department and they're going home. And then there are those who are admitted. So I go review them at the wards there together with the other doctors and clinicians. Yes. But oncology nutrition is I would say it's quite wide. And, due to research, things are constantly changing because some of the information we are using now, like a year or two, we won't be using the same information. But basically, when I'm looking at nutrition in cancer, I divide it into three major parts. The prevention, the therapeutic aspect of it, where now the treatment starts, or you're not dealing with the diagnosed cancer patients.
Okay.
And then survivorship. So there are those who have gone to remission. So they still need to be taken care of. Doesn't mean that because the cancer has gone to remission, you let them just go home and just let them be like that. You need to keep following up because you wouldn't want situation of a recurrence of a cancer or these people developing new primaries. But for prevention, basically, we focus on things like ensuring that someone is maintaining a healthy weight, because issues of obesity, issues of overweight, those people to a lot of risk. So ensuring that people are maintaining healthy weights through and ensuring that they are, they are keeping up with the physical activity levels. They're not leading a sedentary lifestyle. Eating healthy, plant-based diets, reducing on the salt consumption, reducing alcohol consumption, ensuring that if it's for the women, they are practicing what we call the exclusive breastfeeding. It helps to protect them against breast, ovarian cancer. So those are some of the major things I really focus on when it comes to the prevention bit of it. But now when we are dealing with cancer patients themselves, it's a bit different because treatment has started. It could be chemotherapy, radiotherapy, surgery. It could be a combination of chemotherapy and radio. So all of these treatment options have side effects, just like the way we take normal medicine and you experience side effects. So it's the same for the cancer treatment options. And some of these side effects really affect the nutrition status, which in turn affect the quality of life for these patients. So if like someone is having nausea, they're having vomiting, the sense of taste is diminished, they're having trouble swallowing. So that is when I come in and try to optimize their intake as much as possible. At times we go past oral and we have to look at other ways that this person needs to get the nutrients, like enteral nutrition, parenteral nutrition. Yes, so that is basically the medical nutrition therapy for oncology or for the cancer patient. And then when these patients have gone to remission, which they have now entered into the other stage of survivorship, what we try to ensure is that they do not experience recurrence. So you ensure that what you had discussed under prevention, you still talk to them about that, ensuring they're maintaining a healthy weight. Because like one of the major problems we face is that when these cancer patients go to remission and they become now survivors, the treatment was probably so hard on them that they were not able to eat properly, but now they're able to eat properly. And so you find that some really gain weight, and that is a risk on its own because this person can experience recurrence of the cancer or they can develop new primaries. So that's why it's very important that we are working with them even after the treatment is done. So when you're looking at survivorship, we have the early survivorship, which is like 1 year after a period of from remission up to 1 year. That is what we call early survivorship. You find that a lot of these patients are still going to experience the side effects. They're not completely gone. So I also manage that and ensure that the quality of life has improved for them. They're able to do they're able to slowly go back to the things they would normally do before they were ill. So oncology nutrition, I would talk and talk and talk, but oncology nutrition is pretty wide, and I hope I've just given like an overview of what it entails from the prevention, up to survivorship.
Absolutely. And I think it gives our listeners some hope that people can get better, but it's very labor intensive.
Yes, we have had success stories, and I think that those are the ones that make us wake up and just go to work, because we work with that hope that things will get better. We are always working with that optimistic attitude, and we try to spread that even to the patients, to the caregivers or the families of these patients, because things can get better. Actually, we are there to give them hope. So
and that gets into with all disease recovery, particularly cancer, that mindset, that positive mindset, that belief that, hey, I can get better. I can heal and recover. It's so important.
Yeah, we are always talk. We actually, in my team, we have, we also have a counselor, a psychosocial counselor. So she's always working with these patients from diagnosis to when treatment starts, all through during treatment, survivorship. If it comes to a place where it is just hospice, they are always working with the patient, they are working with the family of the patient. So the mindset is very important, because you can't really separate illness and things like anxiety, because, you know, people are always anxious. What is the outcome? Am I going to die? Am I going to deplete my finances? And so if they are always worried, it means that their mental health may also be affected. And that's why the psychosocial aspect of it is very important. You can't separate oncology or dealing with cancer patients from that at all.
Can't. You really can't. Now, how is your plant-based diet? Do your patients have access to good quality vegetables, fruits? Do they have that access when they're home?
I would say I deal with different strata of patients. So there are those that have access to some of those things, but then there are others who really struggle, because cancer treatment itself is quite expensive in my country. And so you find that there are those who really struggle because they need to foot the bill for the treatment, and they also need to ensure that, you know, the nutrition aspect of it is taken care of. But we try, for those who are not able to afford the low socioeconomic status strata, we try to provide supplements that they don't need to buy. We just give them freely. But for those who are able to afford, we encourage them to focus on the plant-based diet. But when it comes to medical nutrition therapy for the cancer patients, we try not to restrict so much that avoid things and eat this, because of the side effects, you're really trying to ensure that this person has as much as they can, but of course in the healthy range and in the healthy way. So I think the restrictions may come in during the prevention phase and the survivorship phase, but during treatment, let's try to ensure that, because of the nausea, some have had weight loss, some are cachexic, really bad. So you wouldn't want to be restricting, you know, yes, you wouldn't want to be restricting food for this kind of a person. So you just, you encourage as much as they can.
As they can. So that gets into another issue, Brendah, is the public health issues in Kenya for people with medical and emotional conditions. You know, and you're on the front lines. I mean, you see so much. What do you see as the needs, where things need to move in the public health arena?
So the first thing is public health sensitization itself, and this is something I'm always talking. I'm very vocal about. I think my colleagues know that about me so much, because once you have given people, you have provided people with the education, you have empowered this. But if this person is in the bracket of ignorance because they lack that knowledge, they may not be in a position to protect themselves. Or they may not be in a position to do those things that reduce the risk for, you know, some of these conditions that we're really dealing with. So the first thing for me, according to me, is public health sensitization. Educate the public as much as I can. right now on Sunday, I have a camp I will be attending. It will be in church, and we're going to be talking to people about nutrition and mental health. And then like several Sundays back, I also had another medical camp I was attending in church. And we were actually dealing with all conditions, yes. So, churches are a very good place because that's where we have a lot of people gathering at the same time.
Right.
And if you wait for some of these people to come to hospital, it will take forever. So public education, public health sensitization as much as I can. That is the very first thing for me.
Yeah.
And the second thing is prevention and screening and diagnostic processes.
Yes.
Because one of the problems we're really facing right now in my country is late diagnosis. I deal with a lot of cancer patients on a daily basis, and you find that in most cases that the diagnosis come late. Stage 3 diagnosis, stage 4 diagnosis, and when it has gotten to that point, it becomes even an issue in terms of treatment. So if some of these issues were realized much earlier, stage 1, stage 2, they would have been easily manageable. But the later they are discovered or they are diagnosed, the worse even the prognosis. So ensuring that you're bringing these services to the community is very important. That people are being screened early enough. People are being educated on how to prevent some of these diseases. Reducing the risk for these diseases is very important. Yeah. So that would be my second.
Yeah, well, that's huge.
Yes. The third one, I would say, is research centers. We don't have much of those, and also you can't really separate health or public health matters and research. Could you just give me 1 minute kindly?
Absolutely. You know what I'll do? I'll pause the recording for a minute, okay? And then we'll hop back on.
Okay. Thank you.
Okay. All right. So, Brendah, we were talking about some of the public health issues. And there are many. There are many public health issues.
Because sorry?
No. Go ahead. What I'm hearing is the church is an excellent place. The church.
Yes, I was research centers.
Right.
Not just the church, but when you're looking at the population I live in or amongst right now, the only way that you can get a lot or a large number of people together at the same time is church, because a lot of people attend church. From where I am right now, we have Sundays. Majority of the people go to church. It's like almost mandatory in every household. I don't know. So you find that it's a very good place to find people and talk to them about these issues, because when you invite these people to the hospital there, they won't come.
Yeah.
So when you can find them in large numbers at the same time, I think that's the best place to conduct your education.
Right.
So, yeah.
So you mentioned you're going to start with the nutrition and mental health.
Yeah.
And can you talk a little bit about that? Some pearls for people to give them some guidance?
Yes, We will talk generally. I won't go into so much, a lot of deep information because of the different population subgroups that will be present. But basically, when you're looking at mental health and nutrition, you find that some of even the mental health conditions that are very common, anxiety, depression, any kind of mental health issue affects nutrition status very much. So you can find that some people actually overeat when they are stressed. Some people undereat when they are stressed. And if some of these issues are not dealt with and this person is dealing with a mental health issue for a long time, it will either expose them to things like being overweight and excessive weight gain, or they can be underweight. Also, when you're looking at certain population subgroups, like the teenagers, there's a lot of peer pressure that happens in that age, and you find they are very much predisposed to things like eating disorders, things like anorexia, purging, binge eating, things like those. So you really can separate, because some of these eating disorders have a great impact on the nutrition status of an individual, whether it is overnutrition, undernutrition, affecting the metabolism. When you're looking at girls, affecting the menstruation cycle. So it's actually something that is quite deep. So, but those are like some of the things I will be touching on, and what's we're going to with one of my colleagues who is social, sorry. So we're just trying to match those two things, mental health and nutrition, and just see, how best can we help people.
Absolutely. And
by putting this,
it's so true, because you ask yourself, which came first? Was it the mental health, or was it the diet, or is it a little bit of both? And if the body doesn't have the nutrients, it impacts everything: your mood, your focus, your concentration, and then the receptors in the brain with the anxiety and all of that, if you don't have the proper nutrients.
Yeah, so it's really important. It's something that we have not really talked about much. I think I've not had other discussions about mental health and nutrition. They feel like two very different things coming together, but they are really important things coming together, and they have an impact. Both have an impact, and we just, we have always looked at them separately, but I think it's going to be pretty exciting bringing them together and seeing, what are some of the things that we can actually do to bring these two together.
Exactly. And I don't think people realize that the gut has all these nerve chemicals, all right? So you've got all this serotonin, and the gut it's the second brain, and if you take good care of the gut, it's going to help your mood, your energy, your focus. And it sounds like you're right there on the cutting edge. You're over the target.
I was actually telling my friend this week that the feel-good hormones come from your gut or from what you eat,
right?
And there are various things that we eat, and we're going to blame our bad moods on everything else, but we don't know that it's probably what you ate. Exactly. Because it all has an effect on the hormonal aspect of it. So if people are not paying attention to these very small things, they miss the whole point. So I'm
That's
really
right.
excited to be
Oh,
doing
it's
this
awesome.
actually.
Really
Yeah.
awesome.
Yeah.
Now, the other thing is with the gut, you've got the good bacteria and you've got the bad bacteria. And that bad bacteria, if
Yes.
they're producing all this junk, it's flooding your gut,
Mhm.
and then and it leads to all kinds of problems. And we don't think that our gut has bacteria.
Mhm.
We don't think about it, that we have microorganisms in our gut. And if we feed them well,
Yes,
right?
we
If we
have.
feed them plants and good food, you're good to the bacteria in your gut, and then they're going to be good to you.
Yeah. So the gut is very important, and as long as you're not taking good care of your gut, you're just going to have just a lot of issues blowing up out of something that is very small that could be handled if if you are actually careful enough to realize things like those with that kind of importance.
Exactly.
And I'm really excited.
Oh, you should be. We're so proud of you. This is huge. It's really huge. And you know what? You're going to help so many people. You're going to help
Thank
so
you.
many people.
I am looking forward to Sunday.
Now, let me ask you, in Kenya, because I mean, here in the US, I mean, we've got lots of junk food, okay? Food that has no nutritional value that people love, and they're feeding the bad bacteria. And that's, so when we work with people with mental health, we really try to hone in on that. Now, in Kenya, what are some of the junk foods that people are eating?
Well, we have a lot of junk food, and the problem is that you find that a lot of this junk food is quite affordable. It's which means that it's able to reach a large number of people. We have processed foods out of the plants, like the potato crisps, overly flavored things like popcorns, cakes, biscuits, cookies, lots of candy, lots of chocolate, and different. Whenever you're like walking in a supermarket, just right next to the attendant there, we have like, I don't know, like almost 50 different types of chocolate. Well, not 50, but almost. People have so many options that if you don't, there's a cheaper version, there's another different version, just so many things.
God.
And I think what needs to be done about that, because I think it's getting, we're treading on dangerous waters, because in my country right now, we're dealing with, the double burden of malnutrition, the overnutrition and the undernutrition at the same time. And so if we're not really paying attention to some of these key things like the junk food, what is there in the market, we are actually heading to a direction I don't even want to talk about. But I think what needs to be done is the public health awareness, sensitization, and also for the government ensuring that they have policies to govern this marketing of some of these products, because just a manufacturer can think of something and then it's released to the consumers, and that is not healthy, and that is not safe. So to have like stringent can help at least reduce the amount of this junk and processed foods that we have in our markets.
Yeah, you speak to such an important issue. We certainly have it here. I mean, much of what's in the grocery store, it's really not good for you. But
Yeah.
but like you say, you're starting with education. So people,
Yeah.
and it's tempting, right? You're standing online and you see a chocolate bar. It's like, oh, that's going to be good. It tastes good, but then you pay the price. You pay the price. And that's what people just don't understand.
I think also making fruits and vegetables affordable is also going to play a role. At least it's going to help in reducing the, if you reduce the junk but you increase the availability and affordability of these other healthy options, I think there's also going to be a shift in terms of how the consumers buying and using some of these things. Yeah.
Exactly. But it's got to be more affordable.
Affordability is key. Yes. You can have something in the market, but it can be available, it can be accessible, but if it's not affordable, you're not helping the consumer, and especially from those of low socioeconomic status, you're not really helping. So affordability is key. It's very important.
Absolutely. Well, and then you mentioned, we talked about cancer. Now, what are some of the other health conditions that you work with? We talked about mental health. What other health conditions? Some of the big ones.
We deal with a lot of diabetes. Is a lot of it. We have a lot of hypertension.
Okay.
We're having cardiovascular diseases, lots of them.
Wow.
Basically, we have the NCDs, or the non-communicable diseases, are so many, and that is as a result of issues like overweight and obesity, because the number of or the prevalence of obesity and overweight in the country is also going up, which means that it is somehow still translating to the increased number of the non-communicable diseases and non-communicable diseases related complications, respiratory illnesses, apart from the infectious ones, the ones that come from things like people being so overweight.
Right.
So those are some of the major conditions that we deal with almost on a daily basis. Oh, and kidney diseases. There are also so many that nowadays you find that even for the cancer patients I deal with, a number of them have these kidney diseases.
Really?
And it's really sad. So yes. So those are some of the common ones, the major common ones,
right,
that I deal with on a daily basis. And it's actually sad because you can't really separate, just like I said, overweight, obesity. I was just looking at the WHO publications, and they were saying that the double has increased fourfold since 1970, from 1975 to 2016. So you can imagine 10 years from now, what will it be? How will it be? And so we're just hoping that with the improved technology and things like screening and detection of some of these conditions, and of course, with technology, people have the information that now some of these things are also going to come and reduce, because
right,
people will have information, the right information, the
right,
health information that they need to prevent some of these diseases. So we are just hoping for the best, and we're doing the best we can to ensure that those we have in the preventive phase do not translate to the therapeutic phase. They'd rather remain in the preventive phase. Yeah.
Well, and it takes heroic efforts like yours, Brendah, because you're truly on the front lines.
Thank you. Well, I'm not alone. I don't work alone. I have a really good team who we're working hand in hand and
Yes.
ensuring that we're doing the best we can in our capacity to ensure that we have impacted. When you wake up in the morning and you go to work, you have impacted somebody's life at least. Yeah.
Wow. Wow. And I'm sure you get tremendous satisfaction from that.
I do. Oh my goodness, I do. Nothing is good. Like I remember there are times I was doing things that I was not really passionate about. And now I do things that I'm passionate about. And even if my schedule during the day is very hectic, I don't come home and feel like I'm exhausted or I'm drained. I still have the energy to do the house chores, and get something done, cook dinner for myself.
Yeah.
So it's really fulfilling. I feel re-energized by the end of the day. I feel good. Like, yeah, I did good. And well, thank you for noticing that. But yes.
Oh, I do greatly. I've been in healthcare a long time, and I greatly appreciate what you're doing. Greatly appreciate it. And I know how labor intensive it is.
It is. It is. Thank you.
And you're thinking preventatively, you're thinking proactively, and getting to the people so that they're aware. Because I'll be honest with you, Brenda, all the information in the world means nothing if you don't have a person. People need that personal connection. They need somebody, like yourself, that they trust, they respect, and the chances that they're going to follow up with that information is so much better.
That is so true, because also when you're looking at some of the information, we and for ourselves, we are health workers, we understand the medical jargon and all of these medical words. So this person, even if they would have the access to this information, they may not understand everything because of these medical terms.
Right.
But when someone like we are there to help them and break this complex information to simple information that they can take. I think it's really important. How the information gets to the other person is also very important to ensure that we have that aspect of behavior change.
Exactly. Because you know as well as I, if people see a nice chocolate bar, it's not easy to tell, and it's cheap. It's not easy to tell them, don't buy it and don't eat it. But when they understand, you got a much better, and then they need your support. They need your support. It's because the obesity, and you mentioned, before we close, I want to mention this, the issue of malnutrition. You can be overweight, but you can be very malnourished because you're eating junk food. You're not getting the proper nutrients in the brain and the body.
Yes, you can, because in most cases you find that a lot of these diets for the people who are overweight and obese, if you're just so keen on what they're eating on a daily basis, the healthy options are put on the side. The fruits, the vegetables, the legumes, the cereals, the grains, the nuts. They are put on the side, and then there's a lot of intake of this unhealthy.
Right.
So you find that there are also people who are dealing with nutrient deficiencies, which is it's really just need to be done. It's very important that people understand that it's also on discipline and consistency, because we can only do so much. I can break down that information. I can follow up on you almost on a daily basis.
Right.
But it's up to you to decide that, this is not good for me. And if I continue doing this, I will end up with obesity or obesity-related complications. So it's up to me to stop. So I think people also need to understand that health workers are not like magicians or miracle workers. We do what we can. And then the other part is
Well, you do work
yeah.
with it, because if they didn't know, if they didn't have you, if they didn't have the connection with you and trust and listen to you, then you wouldn't have anything. You would have nothing, because the information alone is not enough. People are not going to be gravitating to that information. They're like, what is, they don't understand it. It's not, it doesn't, but if you can connect with them, it's mentally and emotionally, like you, it makes all the difference in the world.
Thank you. Thank you so much.
Any closing words? We're getting ready to sign off now, Brendah. Any closing words for our listeners?
Well, yes. I think I'm going to like cut it very short, but first of all, go seek the information. Go understand where you are health-wise. It's very important. Do not wait till you're sick, very sick, immobile. That's when you're going to the hospital. Take advantage of the wellness clinics, so health status healthy. There's a quote I saw somewhere, and it read that what you eat, what you wear on the inside, transforms to what you wear on the outside. So what you eat or what you feed your body transforms
Right, transforms who you are on the outside.
You look, how you perform at work, relate with other people. So it's very important that you're paying attention to what you're eating. Yes. The other thing I would like to say is that let us take care of our children, with obesity being generational issues. So observe certain traits of a child when they were young. It's very important that you take action on that, ensure things so that it does not become a generational thing. Those are marks. If you need any information in terms of what you're supposed to eat and things like those, any health condition, it's very important that you line with a health care worker to, just for the cause. Nowadays, we have a lot of marketing gimmicks outside there, and products are being advertised that are not really good. That knowledge that this is good for me, you'll end up a victim of some of those things. So it's very important that have a health worker close to you. You can always text them a bit, call them, ask them a question. It's very important to have these people around you.
Vital
also,
information.
thank you for having me.
Oh, it's a privilege, Brendah.
I
We're
was
so
really
proud of you. We're so grateful for all the hard work you're doing. And you're helping so many people.
Thank you. Thank you
how
so
can
much.
how can our audience follow you? What platform are you on?
So I am on LinkedIn, Brendah W. Kihara. I am also on Facebook. Well, I'm not so active on Facebook, but I'm on Facebook, Kihara Brendah. I am on Instagram, Wangithi Kihara. So WANGITHIKIHARA.
You know what would be great is that when we're done, if you would just email those to me quickly, because what I would like to do with the broadcast is include those addresses so people can be.
Yes. Yes, sure. I would love to.
It's a privilege. Brendah, this has been an absolute privilege in your busy day, and to take the time for our listeners, because what you're talking about, this is life-saving information.
Thank you for having me, Mary.
It's an absolute privilege, an absolute privilege. So we'll put your information below the video and share this with people.
Okay, no problem with that. Sure. Thank you.
Thank you
once
so
again.
much. And I hope we can connect again soon.
Yeah, sure.
All right. Bye-bye.
Bye-bye.